Hi everyone, and welcome to orientation for the Metro East Medical Reserve Corps. This recording is a brief overview of unit operations, so please be sure to read the volunteer handbook and contact the unit coordinator with any additional questions. Contact information for the unit will be available on the final slide. During this training, we're going to discuss the background of the Medical Reserve Corps program and touch upon the role that the MEMRC has in emergency preparedness and response. We'll also do a high-level summary of MEMRC basic protocols, and again, we ask every volunteer to read the volunteer handbook, which goes into much more detail. Finally, we're going to discuss the National Incident Management System and the Incident Command System. First, it's important to review acronyms that will come up during this training. The first acronym many of you may be familiar with is MEMRC, which stands for Medical Reserve Corps. You may see MEMRC in our correspondences. That simply means Metro East Medical Reserve Corps. The next two acronyms have to do with where we operate in terms of the federal government. So the MEMRC is a federal program that's organized under the Assistant Secretary for Preparedness and Response, which falls under the Department of Health and Human Services. So the Assistant Secretary for Preparedness and Response, that acronym is ASPR, and which falls under HHS, Department of Health and Human Services. Next, we have MDPH, the Massachusetts Department of Public Health. And then the next two acronyms we have are NIMS and ICS. NIMS stands for the National Incident Management System, and ICS stands for the Incident Command System. NIMS is the national approach to incident management, and ICS is an organization tool under NIMS. We're going to go into more detail about these two later on, so don't worry if they don't make sense. The final acronym that comes up very often is JITT or JIT. JITT stands for Just-in-Time Training. This is the briefing that you are going to receive on scene at an activation or deployment. So this will include any site-specific details, a safety briefing, and any other information that you need in order to fulfill your assigned role. As members of the MEMRC, it's important to have a general understanding of who we are and what we do. So I found the best way to describe this is through how we came to be. So following September 11th terrorist attacks, thousands of spontaneous volunteers stepped up to assist first responders. However, there was really no way to integrate them into response efforts. These individuals may have professional licensures, but they were overwhelmingly unfamiliar with policies and protocols. Additionally, there was no way to confirm someone was who they said they were, and those in charge couldn't easily complete background checks and then do the entire credentialing process. So the MEMRC was created as a way of organizing, training, credentialing, and verifying volunteers to integrate into emergency preparedness and response efforts. So in July of 2002, the first grants were awarded to create MEMRC units on the local level. In 2006, Metro East MEMRC was established. Now, some of you may know us as Region 4B MEMRC. The name of our unit was just changed in 2019. So, a spontaneous volunteer is any individual who's willing to help out. They're not associated with any particular organization and therefore have not had background checks, no vetting, or any job-specific training. These individuals may have the best intentions, however, they're actually a drain on response resources. Often, first responders have to be diverted from their assigned roles to address spontaneous volunteers. So it's for this reason that many municipalities and agencies will not accept spontaneous volunteers. But as an MEMRC volunteer, you're an affiliated volunteer. So affiliated volunteers are part of a group or organization and have been vetted, verified, and credentialed. So their parent organization or group will provide training so that volunteers know their role. Affiliated volunteers, they deploy under the direction of their organizational leadership, who themselves have a relationship with the requesting entity. So affiliated volunteers are important because it means we can deploy the right resources at the right time to the right area. On this slide, you're going to see the mission statement of the Metro East MEMRC. I won't read it verbatim. However, in summary, we aim to organize, train, credential, and verify both medical and non-medical volunteers in order to integrate into emergency preparedness and response efforts. Let's briefly look at the MRC program by the numbers. So on the left, you have national numbers. As mentioned earlier, the MRC is a federal program that's organized locally. So there's nearly 800 MRC units that cover all 50 states and US territories. These units are broken down into 10 regions. Massachusetts is part of Region 1, as is all of New England, and there are over 182,000 volunteers that participate in MRC activities nationwide. Now on the right, let's take a look at our local numbers. There are 36 MRC units in Massachusetts. Metro East, we're a regional unit, so we cover 18 communities. Now we're going to take a closer look at which communities these are on the next slide. And it's important to note that those 18 communities together have a population of approximately over 664,000 individuals. And in total, Metro East, we have approximately 600 volunteers. So MEMRC, along with 3 other units, make up what is known as Massachusetts Region 4B. MEMRC are the 18 communities highlighted in blue. You'll also see Brookline in orange, Newton in yellow, and then in green you have Norfolk County 8 MRC. You'll notice that some of the units like Brookline and Newton, they cover individual communities, whereas Metro East, as well as Norfolk County 8, were regional units that cover multiple municipalities. There are 4 MRC competencies that inform all of our activities and trainings. So we'll briefly go through these just so you have an awareness of what they are. The first is volunteer preparedness. That involves demonstrating personal preparedness and preparedness as a unit for public health emergencies. Next, we have volunteer response. Here, we really ask ourselves, do we know our role in emergency preparedness and response? Do we know how to communicate an emergency situation? And do we know where we fall on the chain of command? Then we have volunteer leadership. This involves demonstrating situational awareness of risks and hazards before, during, and after an emergency. And finally, there's volunteer support for community resiliency. Here we ask ourselves if we understand the ethical principles, the legal principles, and considerations for all ages, populations, and communities. One of the most frequently asked questions is, what will I do exactly as an MRC volunteer? And to be honest, the answer completely and totally depends. On a blue sky day, our volunteers are involved in anything from supporting community events such as parades, blood pressure clinics, health fairs, but we also assist in emergency shelter operations or vaccination clinics, and even disaster medical support. A second question we get is how often are activations? And to be honest, the frequency also depends. Some years we may support a few community events and a few fall flu clinics. Other years, such as during the COVID-19 response, we may be sending activation requests every single week. There may be multiple requests going out every week. Our level of activity directly corresponds to what the current environment is. Now, we will also always offer frequent training opportunities. Typically, these may be in person and hands-on, but with current physical distancing requirements, we have made the decision to only offer virtual training opportunities. Many of our trainings all do have CEUs and continuing education credits, so be sure to check on that beforehand, reach out to the unit coordinator, and just ask if they are available. So there are a few things we expect from all our volunteers. The first priority is safety. We expect that everyone carry out their responsibilities safely and that everyone must only work within their scope of practice. Many of our activities may include you coming in contact with personal information, so it's essential that all MEMRC volunteers maintain confidentiality of those we serve and those we are volunteering with. We also serve all people. We serve all people regardless of race, color, religion, nationality, sex, age, disability, English proficiency, economic status, or sexual orientation. Again, we serve everyone. Next, volunteers must refrain from speaking to the media unless given permission by the unit coordinator, public information officer, or incident commander. Now, we're going to discuss who those last 2 individuals are, the public information officer and incident commander, We're going to go into that when we talk about NIMS and ICS. The last thing is volunteers must never self-deploy. It's inappropriate to show up to a structure fire or some other emergency to identify yourself as an MRC volunteer and then offer assistance. All activations and deployments must go through our office. So there's two forms of communication that we have here. The first, non-emergency communication. This will always be done through email, the one that you've identified in your MA response profile. Now, non-emergency communication may include basic unit information, training opportunities, and activation requests. Occasionally, there will be emergency situations that require us to get messages out to you more quickly. So these messages will be disseminated through email, phone, and text messages. Please note that you must give us permission to text you in your MA response profile. So we're going to go through how to do that right now. So when you log on to your MA response profile, you can change your contact preferences first by clicking My Profile on the top banner, then clicking Contact on the gray banner. Your primary email address will be the manner in which you receive the vast majority of unit contact. Contact method 1 should be your primary phone number. This will be the number that our office uses to contact you. If you would like to receive text messages, please click Add Additional Contact Method on the bottom right, select SMS text message, and then put in your cell phone number. Let's briefly go over activation deployment processes. So as we just talked about, you'll receive an activation request via email, call, or text. The first step is to respond if you are interested and available. From there, someone in our office is going to confirm your eligibility, and then we'll assign you a volunteer role. If the activation fills up, you may be placed on standby, which means we will have you as a backup in case someone calls out. From there, volunteers are expected to follow unit-specific and activation-specific instructions that come from your unit coordinator and your site supervisor. Again, volunteers should never self-deploy. All activations will come from a unit coordinator, and self-deploying is grounds for dismissal from the program. Now, please note that all unit activity is volunteer. You should never feel pressured to accept an assignment that A, you're not interested in, or B, you're not comfortable with. Now, the MRC, we do not have minimum volunteer hours to maintain status within the unit. So we don't care if you don't volunteer for a year or do 100 hours in 1 year. We understand that everyone is responsible in other areas of their life, be it family or work. So there is no pressure. And finally, safety is the #1 priority. If you're ever in a situation where you don't feel safe, please immediately bring your concerns to your site supervisor and your unit coordinator. Now, your unit coordinator may not be on site, but you will have their contact information, and please contact them immediately so your concerns can be addressed. All right, so as an MRC volunteer, you can expect to help your community if you're worried about yourself, your household, and your loved ones, right? So here's a few basic things that can help you develop a solid plan and gather necessary resources so you can feel comfortable during an emergency to respond to an activation request. So ready.gov has great resources to help not only identify hazards and risks, but then how to mitigate, plan, and prepare for them. So again, as we know, communication is key, and it's very important that you stay informed. So figure out what the best way is to do that. Check and see if you can sign up for reverse 911 calls in your community. Figure out what it is that you need to do to stay informed. Next is developing a 72-hour kit. Now, this kit should be for everyone in your household, and don't forget about your pets, right? So be sure to pack everything that you may need: food, clothing, toiletries, medication, durable medical equipment, etc. Ready.gov has awesome lists that give you ideas on how to develop your personal 72-hour kit. Now, the last two things on this list, these are plans that every household and family really should have. Again, Ready.gov will walk you through these, so please check it out. All right, we're going to go into talk about NIMS and ICS. We're just going to skim the surface. So there are 2 FEMA trainings that we request all MRC volunteers take so you can be better familiar with the details of NIMS and ICS. We're going to provide details on how to get to those trainings later. We'll start with NIMS. NIMS, again, is the National Incident Management System. So in 2003, Homeland Security issued Presidential Directive 5, and this called for the creation of a single, comprehensive, standardized approach to domestic emergency management. So NIMS is a consistent national framework that's utilized by all levels of government, as well as non-government organizations and the private sector. So this collaboration really ensures that everyone can work together effectively and efficiently, regardless of the incident cause, size, location, or even complexity. So when you see NIMS, I really want you to think three things. I want you to think all events, all levels, and all phases. Next, we're going to go into ICS. So ICS stands for the Incident Command System, and it's a management and organization tool that is used to prepare for and respond to emergency events. So ICS is used by all response agencies and organizations, and it really provides a common language and a top-down modular organization that can be geared toward the size and complexity of the event or incident. So ICS is used in emergency situations like structure fires, disaster response, mass casualty incidents. But ICS is also used in non-emergency events like parades, sporting events. Actually, even the Olympics utilizes ICS. So ICS creates clear lines of authority and provides accountability, reporting, and structure. It also eliminates duplication of efforts and resources, and it really just provides a basic framework to handle any incident. Here, we're going to look at the structure of ICS chain of command. So at the top, we have the incident commander. Now, this is the single person who is in command of the event. They are the final decision-making authority. Under the incident commander is the command staff. So this includes the public information officer, or PIO, there's another acronym for you, the liaison officer, and the safety officer. The command section, they're responsible for developing and directing and then maintaining communication and collaboration on site. So the public information officer, again abbreviated PIO, they're the conduit of information to and from not only internal stakeholders, but external stakeholders. They are the only person that should be speaking to the media. The liaison officer, they serve as primary contact for supporting agencies assisting at the incident. And then there's the safety officer. They monitor safety conditions, and then they also develop measures for assuring the safety of all assigned personnel. The next tier in the ICS structure is general staff. Now, here we're going to conceptualize these roles using an emergency dispensing site as an example. Emergency dispensing site is also abbreviated EDS. An emergency dispensing site, you may have heard the term pod used. Outside of Massachusetts, these are called pods, which are point of distribution. What they are is they're a clinic that take medical countermeasures, for instance, vaccines or medication, and dispenses them to a larger population. Think fall flu clinic. You're trying to get vaccine, that's the medical countermeasure, out to the general public. So in many cases, fall flu clinics are actually used as drills for EDSs. Anyway, back to ICS. So the operations section handles tactical operations. They coordinate command objective, and they organize and direct all resources to the site. For our EDS example, the operations section will include medical staff, clinical staff, and even security. The planning section provides necessary information to the command center to develop the action plan that will accomplish the objectives. So this branch deals with documentation, demobilization, and even technical support specialists. The logistics section is tasked with providing all the resources, services, and support that's required to make in this case, the EDS function. So again, our EDS example, this would include providing food for staff that are working long hours, making sure the supplies are there that are needed, and then any on-site facility support. And finally, the finance section. This section is responsible for accounting for funds used during the event. Now, it's important you know who to report to and always follow this chain of command, right? So in an EDS, if you're a medical volunteer, you're going to report up through the operations section chief. That's who you should be addressing. So it would be inappropriate to circumvent your direct supervisor and address the logistics section chief or any other section chief or, public information officer or even the incident commander. So overall, these are a few highlights we'd like you to be able to recognize. First, ICS is a key feature of NIMS. When you are part of an ICS structure, it's essential that you recognize who it is that you report to and be sure to follow the chain of command. Often with ICS, you'll hear the phrase, quote unquote, swim in your lane. Everyone has a role during an event, and it's important that everyone sticks to their assigned role and swims in their lane. Again, we only skimmed the surface of what you should know about NIMS and ICS. FEMA offers IS 100.C, Introduction to ICS, and IS 700.B, Introduction to NIMS. These are really common, so you may have completed them if you're involved in other volunteer organizations or even through your place of employment. Be sure to have the most updated version. So if you have IS 100.B, it's important that you take IS 100.C just so you're aware of any updates or changes. So how do we access these trainings? So you visit www.training.fema.gov, then hover your mouse over independent study. And this is what your screen will look like. I highly suggest hovering your mouse over independent study instead of clicking, as if you click, there's many more training opportunities that pop up and it can get very confusing. You'll see the two trainings for NIMS and ICS highlighted on the slide. You'll need to create a FEMA student ID number and to complete the courses. FEMA will then issue a certificate of completion after the exams. These certificates can then be loaded to your MA Response profile. If you already completed the most recent versions of the trainings, there is no need to retake the course. Please also just let your unit coordinator know that you've completed them and reach out if you have any issue uploading them to MA Response. All right, so here you'll find the contact information for the Metro East MRC. There's also a link to our website and our social media handles, so be sure to check them out. Thank you guys for your commitment to our unit and for your willingness to serve your community. We are so grateful to each and every one of you. And please, if you have any questions, reach out. The email and phone number are right on the screen. So please reach out with anything, any questions you may have about the MA Response system or about your time volunteering with the Metro East Medical Reserve Corps. Thank you guys.